So before we get into the training itself, I wanted to take a minute to acknowledge the ongoing protests that have erupted around the country and in other countries around the world against police brutality and in defense of Black lives. Sunrise, both the national movement and the DC Hub have been working really hard to provide support for the protesters and other members of the movement, both on the grounds and behind the scene. So before I get into talking about the harm caused by COVID, I want to say that racism and the longstanding oppression and disenfranchisement of Black communities has caused much more harm than this virus and will continue to do so if not addressed. Naeem earlier today shared with me this cool article about doctors and other public health officials who formed a group called White Coats for Black Lives in support of the demonstrations. And in the article, a doctor named Dorothy Charles, who is like a resident at University of Illinois and an organizer of White Coats for Black Lives, was quoted saying, "Risking coronavirus pales in comparison to all the other ways we can die. Addressing the root causes of racial inequality is more imperative at this point than staying at home." And another quote that I thought was really prescient in the article was from a researcher who said, "It is a cruel twist that the United States' inability to control the pandemic has made it dangerous to protest entrenched police brutality." And so on that note, I want to say that it's crucial to emphasize the fact that our current infection and death rate was likely avoidable and is the direct result of our leadership. And that's not to say that all deaths were avoidable, but our leadership has the responsibility in how they responded to this. And I also want to raise up everyone who continues to show up for racial justice, both on the ground and at home. And then next slide. And so as we begin, I also want to take a moment to acknowledge the land that we are on. As many of us may know, we are living on colonized land, and it's important for each of us to acknowledge and understand the Indigenous tribes and people that lived here before us and continue to live here with us, as well as understand that much of Indigenous culture and history has been erased by many of our education systems, and frankly, many past environmental movements. I know that we're calling from different locations today, so I'm going to verbally acknowledge the land that I am on, and I invite each of you to visit the website that's in the chat, and to look up your address and to drop your own acknowledgement in the chat if you're on different land. I today am on occupied Nacotchtank land. I'm sorry if I'm saying that wrong. The Nacotchtank people were part of the Piscataway chiefdom, and the Nacotchtank village was the largest of 3 native villages located in the area. The name Anacostia, as in the Anacostia River, is derived from a Europeanized version of the Nacotchtank name, and much of DC is also located on occupied Piscataway land. And so I encourage all of you to learn more about the Piscataway people as well. And then next slide. And so here's our agenda for today. Making and donating masks is an important resource for mutual aid networks during the pandemic. And so we decided to start making masks because we believe that everyone deserves a reusable quality mask, regardless of whether they can afford one. And so before teaching you how to make your own masks, we're going to give you some context and discuss why we need masks and how mutual aid protects us, what is happening in our community here in DC, mask best practices, and finally, how to make your own masks so we can donate them. Next. And I also want to take like a second to kind of ground ourselves with like, why is Sunrise doing this? And just like take a minute to look back at our principles. Mutual aid is really a huge part and is embodied in our core principles, especially principle 9 that I highlighted here, which is like we take care of ourselves, each other, and our shared home. And DC is my home, and it's the home of this hub. And wearing a mask helps protect ourselves, but it also protects other people. And so it's a really important thing, and mutual aid at work as well protects other people. And so I think this is really important work that we can do to provide direct service. And then next. So I'm not going to go into the background of the virus itself because I think I listened to it on CNN for 4 months and just can't talk about what the difference between COVID and coronavirus is, but we can get into that at some point if you have questions. And I wanted to highlight how it impacts our communities and like why that's really important. So many people have used the expression, we're all in the same boat, like in reference to coronavirus. And it's really important to understand that COVID does not impact communities equally. And so I put this graphic here to illustrate that we are weathering the same storm of COVID together, but we're really in different boats based on our race, economic standing, and overall like our access to resources. Inequality has always existed in the United States, but during the pandemic, it has been exaggerated and brought into the mainstream attention. So the difference is not that it's new, it's that people are talking about it. Specifically, existing patterns of oppression and disenfranchisement in Black communities has led to comorbidities, which means when you have multiple or other conditions that amplify or like make you more vulnerable to the virus or make the virus worse. Higher incidence of COVID cases, significantly higher death rates for Black folk and other marginalized community and people, and far greater economic losses for Black people. Like a lot of the economic brunt has been bared by Black people. Next. And a lot of this is because we are seeing play out our pre-existing inequalities. So for example, Black folk are disproportionately affected by poverty, unemployment. A crazy figure that I found was that even before COVID hit the United States in full force, and as the overall unemployment rate hit record lows, Black Americans had an employment rate that was almost twice the national rate. So that's always been the case before this happened. Mass incarceration, limited healthcare access, health-related conditions, including heart disease and diabetes, environmental racism leading to respiratory illness. And all of these things are causes of comorbidity. It makes it harder for people to, it makes people more vulnerable to getting COVID and succumbing to it financially, materially, and physically. And next slide. And I think this is Oscar is going to talk about the immigrant community for a minute.
Yeah, so I just wanted to share a little bit of context as well, not just the African American community, which has been hit the hardest on this, but it's also, you know, I thought it was important to highlight the immigrant community and me being, they call us essential workers, whatever that means. I don't feel comfortable with that because of how the working class has been treated, but you know, it's the amount of acknowledgement that now people are getting, especially to undocumented immigrants, right? The jobs that they do, the hardest jobs, the working on the fields, you know, working in grocery stores, working in places like I work in a warehouse, for example. So before COVID-19 hit, people overlooked that stuff, especially, you know, with Donald Trump and his rhetoric, and even well-meaning people who do not experience this kind of stuff. You know, it's important to know that if you're an immigrant or if you're Latino, you're more likely to know someone that has COVID. You're more likely to get COVID. You're more likely to lose a job because of it. And you're more likely to risk going to work. Many of these places, meatpacking plants is another good example of places that employers really don't seem to care. Fortunately, where I work out, they do screen us. In fact, tomorrow I'm gonna go get tested for the 4th time for COVID-19. It's very uncomfortable. So it's the swab, just so y'all know. And so just a little bit of context on what we experience. It is you know, you have to take extra measures. I have hand sanitizer in my car. I have gloves. I have a mask that I wear every day. And a lot of people, and there are even stories that a lot of people that have fevers and, you know, they screen you, you have your, they take your temperature, they somehow put ice and they fake because they need a job. So they need to go to work compounded by to provide for your family, plus the pandemic, plus the unemployment rate. It's a survival scale that people have to go through. And so I just wanted to highlight that and put that in perspective for you and everybody else that wants to share this. And I want to thank you, Gabriel, for letting me share this light and the context of what it means to be an immigrant and what it means to be an immigrant during this pandemic.
Yeah, thank you so much, Oscar, for that. I'm going to hand it over now to Rachel, who's going to talk more about the local context and get into some mutual aid stuff.
Yeah, okay, so hi everyone, I'm Rachel. For those of you who don't know me, I'm actually currently doing my Master's of Public Health at GW, so very in the world of COVID right now, and I've also been a part of the Mutual Aid Network in my ward. So I'm going to be talking a little bit about the public health of COVID in DC and the context we're existing within, both in terms of the pandemic itself and in terms of the political context, and then provide a little bit of information about mutual aid and the way that it has played out so far in DC. But before we get into the numbers, I want to provide a little bit of a caveat to some of these numbers. First of all, they're preliminary. We're still in the midst of the crisis. There's still a lot of changing numbers daily. We don't always know what things mean. So for example, at the beginning of the crisis, we were not testing anywhere near where we needed to be. So we're not sure that the numbers on this graph right here are representative of the actual numbers of people who have had COVID in DC. This number at the top where it says the number of DC residents tested, it's unclear if that means the number of unique individuals who have been tested or the number of tests that have been distributed. Not all of the information that the DC City Council and the Reopen DC committee are making their decisions on are public. So as citizens, we have access to a very different set of information than the city does. And race is not always well kept within some of these numbers. So for example, if you go onto the website where you can get these numbers, which is the mayor's website for her COVID response, there is, yeah, thank you. So the racial categories for the total positives and the racial categories for the lives lost are different categories. They're not tracking race the same for people who have COVID and for people who have died from COVID, which means that trying to figure out case fatality rates for different groups of people is really difficult because not all information is tracked the same. And also it's really important to note that on a lot of our understanding of who is dying comes from death records. And through death records, race is often not decided by family or self-identified. It's either doctors or coroners who assign someone race by their own site. And there is a long history of people not accurately identifying the race of people. So it's also really hard to know for sure that the numbers that we have are accurate and representative. So with all of that said.
Can I interrupt you for a quick question? Is that okay?
Yeah,
so Madeline asked in the chat if we know why some of the documents aren't made public.
Yeah, I don't know that I have a complete answer for that. I think there is some level of HIPAA concerns, so there needs to be a level of privacy, and the smaller units of information you provide, the easier it is to figure out people's identity. So if they were releasing too much information at like a neighborhood level that had racial data in neighborhoods where there was a really small Black population, it might be easy to try to be able to figure out who the data was talking about. So some data isn't released because of the need to make sure that it is HIPAA compliant, which for anyone who doesn't know, HIPAA is basically patient privacy. There's a set of information that people who are not doctors are not supposed to be able to access for patients around medical data. And then I think some of it is just they're only releasing this really basic information. I don't know why they're not releasing the numbers that so the reopening metrics that they're using are different than the numbers they're releasing. So they're not releasing like tests per day per capita. They're not releasing the number of new cases caught every day, even though those are the metrics that they are using to reopen. So when me and a group of other people who are in public health and in medicine, we're trying to basically fact check this DC city government to make sure that they're actually meeting their own metrics for reopening, we had to model some of the numbers. We had to like try to recreate and guess some of those numbers ourselves using models because the numbers aren't publicly available. So all of that's really important context as we get into some of this. So one thing I want to note from this is that so far the case fatality rate in DC is about 5.2% overall. As a little bit of context for that, the US average is 5.7% and the global average is 6.6%. Case fatality rate is the percentage of people who get it who end up dying. It's different than like fatality rate, which is the percentage of the population who dies from a certain cause. So this is like the number of people who are tested positive who will end up dying from it is about 5.2% in DC. Okay, next slide. And so there's a lot of disparities playing out in DC. We're going to talk about disparities in two different ways. So the first one is going to be this number of COVID infections. And so there's differences. If there was no disparities, basically the second pie chart would look exactly like the first pie chart. The number of people who were infected with COVID would play out along racial lines as they existed in the population. We can see that that's not true. About 46% of DC is Black, and Black people make up 47% of COVID cases. So in that way, it's about proportionate, but white people make up 46% of the population and only 16% of COVID infections. And you can see this all other races category. So everyone is tied up in that. And then there's race unknown, and we can guess that the majority of those people are not white because white people would be identified on site as white in these numbers pretty often. So this number tells us about what Oscar was talking about earlier, essential workers, who's still expected to be going to work, who is putting themselves at risk or is unable to shield themselves from risk. People who live in smaller houses with fewer people generally are safer because there's fewer people who are being exposed in the household. People who have been able to work from home because they have nonprofit or government jobs are less likely to be exposed. And so that's where we see some of the disparities between the first pie chart and the second pie chart. But the really concerning disparities are in terms of outcomes. So Black people make up 46% of DC, but are 86% of deaths. And that is a really not cool number. That is like the result of all of those types of racial injustice that Gabrielle was talking about earlier. And we're going to talk about why some of those numbers exist. But if you go to the next slide, I wanted to delve into this number in a little bit of a different way. So Black people are 86% of deaths, and also their death rate is significantly higher. So for white people, the case fatality rate is 3.1%. So for every 100 white people in DC who get COVID, 3 of them will die. For Black people, for every 100 people in DC who get COVID, 8 of them will die. So it is a huge difference in terms of how many people are dying. And then when you put that difference in death rate on top of a difference in who's getting it, so if more Black people are getting it than white people are getting it, and more of them are dying, that is how you amplify that out to Black people are 86% of deaths. And that is signs of racism and disparities at several points in the process, from exposure to outcome. Okay, so next slide. So I want to talk a little bit about some of those types of racial injustice that Gabrielle brought up earlier in DC and how they play out. So if we look at this map, this is percent of the population that is Black across neighborhoods in DC. And you can see that the highest percentage Black populations are in wards 6, 7, and 8. I think Ward 7 and 8 are 92% Black respectively. And yeah, so those are the like wards with the highest Black population in DC. And so here's a couple of statistics I want to tell you as we're looking at that map. So first I want to talk about median household income. So the average amount that families make or households make in DC. In wards 1 and 3, which are both very, very, very white, the average or the median household income is $108,000 and $149,000 respectively. In wards 7 and 8, it's $40,000 and $36,000. So the median household income in Black communities is a third to a fourth of what it is in white communities. So there are staggering differences and inequalities when it comes to wealth and income in DC. This crisis is also intersecting with food insecurity in DC. So there is an average of 8 full-service grocery stores in wards 1 through 3, and there are 2 in Ward 7 and 1 in Ward 8, which means that Black people have a harder time accessing healthy foods, have a harder time accessing food in the first place, often have to travel further to get food, and all have to go to the same grocery stores, which means more people are using the same access points, which risks exposure. Also, of the 12 hospitals in DC, only 1 is east of the river. So in Ward 7 and 8, there's only 1 hospital serving that whole population, and it's actually set to close in a couple of years, meaning that there is like a dramatic lack of access to healthcare in Ward 7 and 8. And all of that plays out, if you go to the next slide, in terms of very different underlying health conditions. So as we know, underlying health conditions is one thing that makes people far more likely to experience negative outcomes, primarily death, with COVID. And so asthma rates are significantly higher in Ward 7 and 8 and in wards or in Black communities in DC. And this is due to a lot of different things, but some of it is just like unsafe air, poor housing, mold in housing. There's a lot of different things that play into this that go along with all the other types of crises that we're talking about, including housing. And this is also true. There's significantly higher obesity rates in Black communities in DC, and Black people have 3 times as many heart attacks as white people in DC. So there's just really significant disparities in health pre-COVID. And so the COVID crisis is exacerbating that. And I did see Mariel's question. So they're closing it to build a new one. Basically, it was a private hospital before, and it was mismanaged and was not providing great services. And so a couple of years ago, the DC city government basically ended the contract and took over. I can drop an article to read about this in the chat in a little while, but basically the DC city government took over running the hospital, but have continued to struggle adequately funding it and providing them the services and the doctors that they need. And so it's been underperforming, often because it's been under-resourced. And so rather than investing money into it to try to help like improve the quality of services that are provided, they basically want to close it down and then spend the next like 2 to 3 years building a new one instead. And there's a lot of internal fighting within the city council and with the mayor about what to do about this hospital in Ward 7 and 8, basically. But I'll provide a couple of articles about that in a little while. Okay, so if we go to the next slide. So all of that brings us to the political context of what's happening right now. So Washington, DC is currently in the phase 1 of reopening. It started May 29th. This means a couple of different things. We're allowed to eat in restaurants again, but only if it's outdoor seating. We have to be seated a certain amount apart. Salons are allowed to reopen by appointment only. parks and golf courses are reopening, gatherings are still prohibited. So it means a couple of different things. But I think one thing to note is this last point in this list: district employees remain working from home. So district employees and often nonprofit and Hill workers are going to continue to work from home during this time. In phase 2 and 3, they might start to be brought back to the offices, but at significantly reduced capacity. So only a couple people will go into the office a couple days a week to make sure that they can continue to social distance. But this option doesn't exist for people who work in essential or frontline jobs. If you decide not to go into work, you lose your job. And as businesses start to reopen, that also means that employees lose access to unemployment insurance. It will become harder for people to access other means of, paying rent and buying food for their families unless they go into work. And so in this time, we are prioritizing the ability of people to go to brunch on Saturday mornings again over the safety of essential workers and low-income communities in DC. And so there's been a lot of pushback from public health experts about reopening. And I will say, as a public health person, I fully agree with what Gabrielle said and what most public health experts have said about protesting is critical at this point. Protesters have been doing a pretty good job of keeping each other safe. Most protests, at least in DC, have been wearing masks. There are huge testing campaigns happening right now to make sure that people can be tested after they go to protests. And there's now a hashtag campaign, Know Before You Go, encouraging people to go get tested before they protest again, to make sure that the fewest number of people are potentially in that space with COVID. And so exercising our First Amendment rights in order to end racism and police brutality in the country is very critical. Brunch and haircuts are not. And by prioritizing reopening and not addressing systematic racism in our country, we are prioritizing the comfort of white people over the lives and safety of Black and brown communities in this country. And I think that's some really important context, especially considering that phase 2 is scheduled for June 19th. So even though we don't even know the impacts of what is happening from phase 1 reopening, they're already planning on reopening even further in a week from now. And if you'll go to the next slide, I want to bring back this graph from earlier. So the couple of numbers that I've highlighted here, the first number that I have, I know it's Juneteenth. The irony is not lost. So March 30th is the first number that I've highlighted. And that's when the stay-at-home order went into place. So at that point, we had 495 cases total. And we have continued to dramatically increase from there. And so this 8,700 number is May 29th when reopening happened. And one of the statistics that they used was a decrease in new cases. So not decrease in cases overall, but a decrease in new cases. But you can see for 14 days prior to reopening. But you can see that according to this graph, cases have continued to grow during that time. DC's peak is not even predicted to be until the end of June. And that number was modeled before Memorial Day, when people were out and about, before phase 1 reopening happened. And by this new, by our modeled peak, phase 2 will have happened. And this was before the protests. So there's a lot of things happening regarding the COVID situation in DC that are unknown, and yet the DC city government is continuing to push forward with reopening, even though we have not even reached our peak yet. And so cases are going to continue to grow in DC. So we are still very much in this crisis, as much as the DC City Council would like to pretend that we're not, so we can go back to business as usual. Okay, so next slide. So that was a lot of information, a lot of angering information. And as much as we are right to be angry right now, we also need to make sure that we're not so consumed with that anger that we can't push forward with the work that we're doing. So I want to take a moment to all just take a deep breath and remember that the DC city government is letting us down, but we can do something about it. We have so much power and agency in this moment And that's what mutual aid is all about, is stepping up when the government has failed us. And so I just want everyone to take a moment to stretch a little, to let some of that anger out so that we can move forward into this conversation about what we collectively can do, excited and energized to go, but not feeling discouraged or hopeless in this situation. Okay, love all the stretching and sitting. Okay, great. Let's go to the next slide. So before we start talking about mutual aid in DC, I want to give a little bit of background on what mutual aid is and what it is not. So I really like this definition of mutual aid that's from the Big Door Brigade, which says that mutual aid is a form of political participation in which people take responsibility for caring for one another and changing political conditions by actually building new social relations that are more survivable. And I like this definition for a couple of reasons. First, I think it's important to remember that mutual aid is political action. It is a form of organizing. It is how we participate in politics without resigning ourselves to the electoral political system we exist in. And I think that's really important to do because the system that we live under is not designed to meet the needs of its citizens and is often designed to exclude and oppress certain groups of people. And so mutual aid as a form of political participation allows us to come together to create infrastructure and social relationships where we can meet our own needs without replicating, recreating, or relying on systems that failed to meet the needs in the first place. And so to do that, mutual aid is voluntary. People who participate in it are not getting paid to do it. You come to it with the acknowledgement that you are there to participate in your community, not to get compensated for your work. It's decentralized. There's no one person who's in charge. There's not a hierarchy. It is a horizontal structure. It's decisions by consensus and by consent. And while there are some people who may be responsible for bottom lining certain efforts, that leadership role is a responsibility and not power. And I think that is a really important distinction that exists. You are taking on that responsibility in order to be accountable to your community, not in order to have power over your community. It's non-reciprocal. If you need something, you are not expected to pay it back immediately. It's non-transactional, and it attempts to be hyper-local. Stuff is happening in DC at the city level, but it's also happening at the ward and at the neighborhood and at the pod level. And it stresses being able to work with your neighbors, to know who you are in community with, and to take care of each other in the place that you are part of, versus it being like distant and transactional and missing that relationship element. It's hyper local because that builds relationships, and that's a really important part of it. And so to that end, mutual aid is not charity. I think often with charity, there is a sense of like moral superiority for the person who is doing the charity, a sense of like power over the person who's on the receiving end. There is a sense that like you are a better person for being able to do charity and a worse person for needing to receive it. And mutual aid just acknowledges that like people have needs and we're here to take care of one another. It's not about recreating power structures, and it's not means tested. There's no need to prove that you are needy enough. You don't have to beg for the help. If you call a mutual aid hotline, we don't make you apply or go through a rigorous vetting process or submit proof of your need. It's just, if you need something, we want to help provide it for you. And so, yeah, I really do like the hashtag We Keep Us Safe. Like we got us. We here are together to make sure that we are okay because the government isn't doing that for us right now. And so I want to take a minute to have like just a short conversation about what does it mean for Sunrise DC to participate in mutual aid in DC. So if you want to add a thought to this, put a star in the comments section. And I will maybe start with a thought, but then I want to stop talking for a minute. But I know that one thing that participating in mutual aid has meant for me personally is an opportunity to feel more a part of this community. I am not from DC originally, I'm from Iowa. And I think it's really easy to feel swept up in the fact that you're in the nation's capital and forget about the fact that you are part of a community that you live in. And I have met neighbors who I never would have talked to through my participation in Sunrise or in mutual aid. And so for me personally, it has helped me to feel like I have put down deeper roots and have made a deeper commitment to this community that I've decided to be a part of. So does anyone else have thoughts on what it means for Sunrise to participate? Yes, Sarah, do you want to say something?
Yeah, I guess I'm like hearing what you're saying, and I really appreciate this presentation. And I guess the question, like the framing of like, what does it mean for Sunrise DC to participate when it's a like hyper-localized, like individual act? Like I feel like, I guess maybe I'm just being critical, and I apologize. But like I've really appreciated Sunrise providing resources and like connections to the like mutual aid efforts. And I guess like if that's what it means for like, is that what you mean by like Sunrise DC participating? Because I feel like it's whoever like then takes up those resources and then goes out into their town, like into their city, like into their neighborhood and like does it. It's like them participating, or I don't know. It would make no sense.
No, I think that makes a lot of sense. And I think that's a really important question for us to be asking ourselves in this time is like, is the Sunrise participating, or is it the people of Sunrise participating and Sunrise being like an entryway into that participation? And I think that questioning that is really important in the process of making sure that what we are doing is mutual aid when we participate in these spaces. And Hannah, do you want to go? And then...
Yeah, sure. I have just been thinking a lot about how like a lot of the things that we talk about when we like are talking about the Green New Deal, and like a lot of the things that I get excited about like with the Green New Deal are sort of like in a way like a form of mutual aid. Like I think a lot of like, yeah, I don't know if I'm saying this right, but like, you know, having like a sustainable local food system, like having community controlled utilities. Like I feel like so much of the future that I want to build comes down to setting more norms that we like take care of our communities, and like understanding that we are reliant on like the people around us. Yeah, so I like in a way like us participating in mutual aid is like a way to like model the kind of future that we're trying to build.
Yeah. Okay, Oscar, do you want to go?
Oh yeah, it's me. Yeah. One of the reasons why I was interested in Sunrise ever since like a year or two ago, you know, is the way you guys, or the way I guess national, but the way the organization talked about climate. It was not just a recycle and then you're gonna hug a tree and it's gonna be great. You know, it centered working class people. It centered minorities. It centered you know, especially for me. And again, one of the many reasons I cannot wait till this pandemic is over and we are all together is because I do want to tell my story, which is insane. But looking at looking at the struggle and then looking what you guys do made me realize this is something I want to be a part of, even though I experienced some of this stuff myself, not to the degree of Black people and not to the degree of the Black immigrant as well. But it's really, really great to see this from a climate organization, not saying, you know, not that condescending tone that other climate groups have had in the past. And this, I mean, this is awesome. And so, and as also as an essential worker, like, and I take that term with a grain of salt because of the way the government have treated us. I'm very grateful. I'm grateful for the presentation, Rachel. I learned a lot. I knew it was bad, but I didn't think it was to that degree. It was that horrible. And, yeah. Thanks. I guess thank you guys. I think Naheem, I think you're next.
Actually, I think Gabrielle's on stack before me.
I'll talk more later. You guys go.
Marielle, you want to go?
Sure. Hi. Yeah, Rachel, super rad presentation. That was like very insightful and great to hear. Yeah, I don't know. I just feel like like obviously like at Sunrise we're working towards like a more just future broadly, but like I've been thinking so much both in this moment of Black Lives Matter and also the pandemic, how it's like we also like need to survive this moment in order to like build that future, and that like so many of the people who you know might be like co-conspirators in building that future, like we need to look out for their safety. But I also think like to Oscar's point about like the hollowness of this like essential worker feels in part because like both the government but also like all of us most of the time walking through our communities don't not, the word appreciate is not right, but there is no mutual exchange between the things that we're getting from those essential workers and you know the things that we are not giving things back to them. And so it feels really important that it's like that work is essential to an ecosystem of life, and if we're part of that ecosystem also need to be yeah, like showing up for those people. So I'm really excited to be doing that here.
So, Naeem, do you want to share something before? Okay. Rachel, do you want to close out, or are you ready to move on?
I'll just say, yeah, I think that all of those are really great points. And I would, as we continue to like get into the action of doing mutual aid, I would just encourage all of us to keep referring back to what mutual aid and what mutual aid isn't, and considering how we are, how we are participating in it and what it means as a movement to be participating in mutual aid. And yeah, I mean, to the point that all you're saying, like, how are we like building the society that we want to be a part of through our actions?
Thank you, Rachel, so much for that. That was really illuminating and upsetting in ways that are really important. Before moving on to the kind of bigger picture, less interesting stuff, I just want to say, like, I have so much love for all of you and for Sunrise and the space that this has created, both in my life and in the community. I think I really resonate with everything that you all said. I think it's so important that we have a movement that centers, you know, people on the front lines. It's not about just recycling, and it is, we are part of a larger ecosystem, and we also focus on the local. So as someone from DC, I still don't feel very connected to my community. Like, I feel more connected to my community now than I ever did growing up here. I grew up, like, I spent most of my life, except for the few years that I went to college in DC. I was born here, I was raised here, and I felt that segregation only after the fact, of acknowledging like, wait, this isn't a city of like mostly white people, which are like the people that I interacted with, given who my parents knew and the people in our community that we live near. And so that's, it's so striking to me now that I'm an adult and I see that. And I am working to correct that and to connect to my community now. But thank you, Rachel, and move on to the next stuff. Oh,
Sorry, I do have like.
yeah, that's cool.
So then just a little bit of the quick context for Mutual Aid in DC. So it began as a Facebook network. It grew into ward-specific networks. We have hotlines, different wards are doing fundraising. Wards have started creating supply hubs, so they're able to make sure that there's like a centralized location for disinfectants and hand sanitizers and some of the really commonly asked for items. And hubs have been coordinating resources like computers for kids who are doing distance learning and clothing and diapers, for people who are living in shelters. And at one point, the city and ward members were actually referring people who called them for help to the DC Mutual Aid Network. So the government was failing to provide services, and so sent them the way of the volunteers who had built the infrastructure to meet their needs quickly. And I think that's a really important note of context for DC. Next slide. So then face masks are obviously required. They are still, there was initial confusion around the April 20th order because it was unclear if they were mandatory or not. And there was fear of how they were going to be enforced. The requirement that you wear a mask in stores was going to be enforced, especially since the government was then simultaneously providing resources to access masks for city residents. And so it was another example of the strategy for handling something being a rule and a punishment rather than a resource to make it happen for the community. And so DC Mutual Aid has been really key in providing masks to people in the city. We'll go to the next slide. So this is a really cool resource, Face Mask DC. It was started by a UMD student who wanted to make sure that people knew where they could get face masks. So some of these are businesses and some of them are people who are just providing them for free. But as DC Mutual Aid was working to create masks, we couldn't meet the demand fast enough. It became the most requested item on the hotlines. There was like a lag in time as people were trying to figure out best practices regarding materials and getting the materials. It takes a long time to sew them. So there has continued to be a shortage, especially as we want to make sure that people have not just like one mask, but like multiple masks, so they can have one that they're like, even if one is in the wash, there's one that they can wear. And we're also unsure of the science of like how long a mask stays protective for, like how many times do you wash it before the fibers become too loose to be protective anymore. And so being able to then like resupply masks is really important. And so all that is to say, this is very pivotal work and DC needs masks. And so very excited that Sunrise is getting involved in this part of the mutual aid work right now. And with that, I'm officially done with my part of the presentation.
Sorry for jumping in there too quickly. Yeah, so this is super important. Going back to some of the, yeah, thank you, Rachel, again. Bigger stuff. When making this presentation, one thing that just a term that really stuck out to me, and this was used in the DC Mutual Aid Network's presentation on mask making as well that I went to, that kind of inspired me to bring this to Sunrise as well, is disaster capitalism. And so I'm sure some of you have heard of Naomi Klein, but this is a term she coined that kind of describes how power profits from disaster. Does someone want to volunteer to read this quote about shock doctrine? You can like drop a star in the chat or just go for it.
Yeah, I can do that. I I use the term shock doctrine to describe the brutal tactic of using the public's disorientation following a collective shock. Wars, coups, terrorist attacks, market crashes, or natural disasters to push through radical pro-corporate measures, often called shock therapy.
Thanks, Sarah. Yeah, so a shock doctrine is, as the quote described, in this case, COVID can be seen as a shock doctrine. Disaster capitalism is what happens in the aftermath. It is how corporations and those in power leverage their power to consolidate it and to consolidate wealth. So we've seen that play out in this pandemic through wealth accumulation, price gouging, and the $2.2 trillion stimulus package that is how some people got their $1,200 checks, that more than anything else included enormous funding for large businesses, including airline companies and a bunch of other fossil fuel companies. And in fact, more funding was allocated to cutting taxes than was given to hospitals, disaster assistance, educational funding, and food stamps combined. So these are our government's priorities right now. This is how corporations have leveraged their influence on Washington and on the Hill to ensure that they stay in power. Elon Musk, Jeff Bezos, and Mark Zuckerberg have all profited off sales during the pandemic while continuing to neglect the health and safety of their employees, including multiple deaths in Amazon warehouses. Next slide. So this sort of stuff, this makes me really mad. And I'm sure you guys feel that too, and upset and just really angry. But you know, we're not powerless, and I do want to bring this on a positive note that there are things we can do. And so a trigger event is like another way of kind of talking about a shock doctrine. It's like a highly publicized incident that dramatically reveals a critical social problem to the public in a vivid way. So again, in this case, that would be coronavirus. This is a turning point. And so, yes, it can be exploited by the wealthy and the powerful, but it can also be a moment for us to make change in the world that we want to see and to create a better future. And so obviously in Sunrise, speaking to what Hannah said before, we want to fight for that through a Green New Deal and a people's bailout. And our theory of change is to use people power, political power, and the people's alignment. The next slide. And so kind of going back to that question that Rachel asked before of what does it mean for Sunrise to participate? I've thought a lot about that as I had kind of developed this month's activities. And it has all come back to this idea of the people's alignment, and that everything that we do in this category is in solidarity with other movements and acknowledges that the change that we want to see in the world is not just overlaps, but is reinforced by and is made stronger by other movements and the change that they want to see in the world. And we can't do this alone, and we shouldn't do this alone. It is meaningless to do this alone. It is meaningless to have a climate movement and an environmental movement that does not account for other movements, and social justice and racial justice and economic justice. So that is why I believe that we should be involved with mutual aid, and that's kind of how I see a people's alignment. And next slide. And so now getting into some of the slightly more boring side of things, I'm going to go over some MASC best practices. And I will just say again that, yeah, so kind of speaking to what Rachel said and also what Oscar shared, these are best practices. This is kind of what is recommended based on the best available science, but not everyone is able to meet these guidelines. Not everyone has the privilege to be able to social distance, to wear a mask properly. And so I want to just take that into account. Starting off by debunking some myths. about coronavirus. There's been a lot of misinformation shared, including by our government, the federal government. The US Surgeon General during in the wake of coronavirus shared this tweet that they are not effective in preventing general public from catching coronavirus, but if healthcare providers can't get them for sick patients, it puts them and their communities at risk. So the Surgeon General advised healthy people to not buy masks in February when we were starting to see a rise in cases in the United States. The CDC continues to recommend that only those that are sick or are in direct contact with someone that they suspect has coronavirus should wear masks. That is still their best guidance on their website and what they are telling people. WHO, the World Health Organization, until last week, until June 5th, had the same guidance on their website. So this is not just limited to the United States. It's a big world. And until June 5th, they updated it that they are saying that now there's new evidence that points to we should wear masks when social distancing is difficult or in areas where there are high case prevalence. Taking a research-based approach is very important, but it's really important to acknowledge that a lack of evidence doesn't mean evidence against. In other words, just because we don't know something doesn't mean it's safe to do or it's not safe to do. So the fact that they have assumed that you don't need to wear a mask just because they didn't have a lot of studies surrounding it is not the right approach. Next slide. So why do we wear masks? First and foremost, we wear masks to protect ourselves, but we wear masks to protect others. So another myth around masks has been that wearing a mask will protect you from getting COVID. This is not entirely true. It can help reduce your risk and filter out some particles, but most masks are not very effective at filtering out anywhere close to 100% of air particles. COVID is spread through droplets that come from your mouth and nose when you talk, when you sneeze, and sometimes when you breathe. So masks can prevent the droplets from spreading, which is why it's important to wear them properly. And those droplets can get in other people's orifices, their eyes, their nose, their mouth, which is also why wearing masks helps people not touch their face as much. I know I touch my face a ton, and I still touch my face when I'm wearing a mask, which is something I'm working on. But something that many medical professionals and researchers are also concerned about is people's eyes, and that people touch their eyes a lot. Even when they're wearing a mask properly, they continue to touch their eyes, and that is another way that it can be spread. But I want to emphasize that we wear masks to protect our community, and it's a matter of mutual respect. So next slide. So these are just some graphics on the do's and don'ts of how to wear a mask. You should wear it above your nose, below your chin. It should cover kind of this portion of the face. It should be as tight as, the tighter fitting the mask generally, the more effective, but it's also dependent on the materials. We want, if you have a nose piece, to kind of push it down, and it shouldn't have too much air going from either side. When you're wearing a mask, avoid touching the mask itself in case you've been exposed. If you do touch the mask, try to sanitize your hands in some way, or really, really try avoiding touching your eyes or face. And when removing your mask, also try to take it off from the earpieces and wash your hands out afterwards. Obviously, it's hard to be perfect, like no one is perfect. But do your best to do these things. Next slide. And so these are some cool graphics that Black Lives Matter DC made on like the effectiveness of different masks. So the N95 is one that's been talked about a lot. This one is, it's called N95 because it filters out 95% of particles. So this is worn mostly by healthcare professionals, and are like not really supposed to be reused consistently, but now because of a shortage are often worn all day. And there have been recent cases where people have fainted due to insufficient oxygen levels, which is really upsetting as well, because it's just like harder to breathe in them. So those are N95s. There are other variations of the N95. There's the KN95. There are new masks that have been created by private companies that are said to be more effective than the N95. I've heard of people buying masks for upwards of $50. I can't afford that. I think that's a really blatant example of disaster capitalism and price gouging. And I think it's absurd that only those that can afford to buy a mask that protects them can protect themselves. Surgical masks are looser fitting. They're disposable. They're not really supposed to be reused at all. They aren't very effective in protecting you, but are often worn over N95s by healthcare professionals and can be used to help limit exposure. And then fabric masks are the ones that we'll be making. And this graphic says they filter out 70% of particles. I haven't seen that figure really in a lot of other places, but I trust Black Lives Matter's research. So I think it depends a lot on the materials that are used and whether or not you're using a filter. But yeah, next slide. And so finally, what we're doing, in order to address all of the emotions that we have, I think the best way to do that is through action. And so we will be making masks. And we talked about why this is so important. We'll be donating them through DC Mutual Aid Network, who has done a great job of prioritizing vulnerable individuals and frontline workers, those who need the masks most. And that doesn't just include healthcare workers. There's a lot of ways that you can help. So we do need people to sew, whether you have a sewing machine or not, whether you are very experienced or not very experienced. You can make masks. I will say it is significantly faster to make a mask with a sewing machine. I had been hand sewing masks before, and it took me upwards of 2 hours to make a single mask. I'm not like a particularly good hand sewer, so maybe if you're like great at it. And now I have a sewing machine that I got recently, and it like takes me like 20 to 30 minutes. So a pretty big difference. But we need sewers. We need people to donate supplies. Jordan was able to get some supplies donated, which is awesome, but getting more fabric and elastic, if anyone has ties, if anyone has other materials, Marielle will go over that sort of thing right after this. But we need people to donate. Also, people that are donating can also help by cutting patterns. It does help make things go faster when the patterns are pre-cut, and so sewers don't have to worry about cutting. So that's another way that they can chip in. We also need people, drivers, people with cars that can deliver materials to sewers, can help kind of do some of that intermediary delivering. So those are 3 ways you can get involved. You can also reach out to Jordan if you want to help with kind of the coordination of mask making in general and see if she needs help. And our goal for now is to make 100 masks by July 1st. I really think we can get there, so I'm excited to get started. And I think I'm handing it off to Marielle.
Great. Hi, guys. So now we're switching. Thank you both for that highly informative background information. So kind of we're going to go through here just some of the basics of mask making, and I'll do some brief demos as well. The sort of overall, my overall approach to this is I'm going to show you one mask type that is kind of like more fitted and is, if you have a sewing machine, pretty easy to do and seems like the best approach. And then I'm going to show you one that is the easiest approach in terms of if you're hand sewing and have a limited time. So there's a million different things on the internet which you can also turn to. I do not claim to be a master at this. I taught myself this basically over the past 3 months and have been sewing a bit, but like did not know how to sew before that. So very much feel like I'm learning with you guys. For starters, materials, hang on, I'm just gonna make my my screen smaller. So in terms of fabrics, the goal is just that you want fabric that actually stops your, spit and particles from leaving your mouth. So tightly woven fabrics, quilting, cotton, t-shirt material. T-shirts are a little bit tricky because some of them can be pretty thin. I've also been using a lot of like pillowcases and some sheets, which are working really well for me. There's a thing that people are calling the light test or the spray test. The light test I find harder because it's like shining a light through it, but a lot of fabrics are transparent or a bit translucent, but still will actually keep particles in. So basically the way that this works, I'm trying to see myself though, yeah. So like I got a little spray bottle here and you just literally put your fabric here and your spray bottle here, and then you look above it, and if you squirt, you can see, great. Doesn't really come out the other side. We're doing pretty well. So this is material that will work. I don't know if you guys can actually see that from where you are, but I can see it from where I am. Then in terms of ties, I think that the best approach to ties is probably going to be making t-shirt yarn, which is not something that I'm going to show you in this demo because it's very, very simple, but we've dropped a link for how to do that in a resource guide that we'll share with y'all. And so that's going to look like this. Basically, it's just cut up strips of t-shirt that kind of like make a diagonal through the whole shirt. And then you can roll it into a ball like this and cut it as needed. So that's definitely going to be my recommendation. Oh wait, I lost the slideshow.
Are you good for us to stop sharing the slideshow for now so people can watch you, or do you want to?
Can we just keep that one slide up and then when I actually shift to demo, if that's possible, just because I don't have the list of materials on top of my head. Thank you. Great. Cool. So then there's also, cut elastics, which you can find online, or if you have them around, that's great too, which is, I don't know where my roll went, but just like normal, like you can get a whole full roll of elastics. I've also seen people use stretchy hair ties that appears to work really well. So that's on hand often. Shoelaces, durable ribbons, also great. And fabric strips with the raw edges on. That takes a little more labor, but is an option. And then in terms of tools, either, again, lots of options, needle and thread or a sewing machine if you have it, something to cut, whether that's scissors or a fabric cutter. Ideally, you want to print the templates for the fitted mask. That makes it easier, but it's also possible to trace on your computer screen. So that's an option as well. You're going to want a ruler and then some form of fastener that can be pins. It can be clothespins. Sometimes when I'm running short, I literally use extra needles and just pin fabric that way. So you can get creative about that. And an iron, if accessible, is also really nice. Great. And then, we can go to the next slide. And then after that, we can turn back to me. So hygiene practices, of course, because this is a tool for hygiene, we want to be careful also about how we're making them. So ideally you're going to want to wash the fabric even before you begin sewing and make sure you have clean hands when you're handling materials. But the big one is washing the mask between the time that you make it and the time that you hand it off to someone else. Because I know my setup here, I don't have a ton of space, so I'm like ending up making masks on the floor and like wish I didn't have to do that. But I'm washing them in between, and that feels like it's a good compromise. But yeah, and as soon as you wash them, you're going to want to put them into a plastic bag so they don't have any more contact with you or other people. And then, of course, we want to, as we're delivering materials, both to anyone else in mutual aid or other sunrisers, make sure you're wearing a mask. And if you're not feeling well, don't be making stuff because you could be spreading your germs. Cool. Any questions on that before I go into some more specifics of the mask? Oh, I'll show you the one more slide just so you can see the full visual of the mask types. These are the two that we're going to talk about today. So yeah, the Craft Passion pleated mask. Oh yeah, there we go. Gabrielle is modeling. Very stylish, amazing. And then a surgical pleated mask. Or it's really surgical, I guess, are the ones that are reusable, but you'll see it referred to as both on the internet sometimes. Cool. Okay, so now we're gonna go through the steps of mask making, unless anyone has burning questions. I don't think so. Okay, so we're gonna start with the pleated mask. And you guys feel free to either click on me or click on the slideshow. I don't know, whatever feels helpful to you guys. So basically you're going to start by cutting a rectangle. This particular graphic I liked just because it had very specific 4 steps, but in terms of the actual size, typically I do 8 by 14 as opposed to this one has 8.5 by 16. It's preference, but just sometimes I feel like that's a lot of fabric for a face. This also says 7 inches of elastic. Again, that can be something that you want to adjust depending on the size. I do think that this is probably a good starting point in terms of making masks for a random person you don't know. But if this were like for yourself or your family, that's just something to keep in mind. So the first thing you're going to do with this type of mask is take your lovely fabric here. And I like to have some type of marking on the bad side of the fabric. This one I measured wrong and then remeasured, but that'll work, to make sure that I'm folding it in half with the bad side of the fabric facing outwards. If I had an iron, which I did where I was living before, but not now, I would also just iron that so I would have a nice crisp fold. And then the next thing I'm gonna do is sew along this open edge here. And usually you're gonna want about, like, I would say half to a quarter of an inch seam. So my cheating way of measuring that is just that like my index finger is about that width. And so I usually just take my finger and use that as a marker. If you feel like it's helpful to you, you can of course draw a line with a ruler as well. I was gonna do my hand sewing specifics, but maybe I'll actually do that now with this piece of fabric. So this type of mask, this pleated one, is definitely going to be what you want to go for if you are A, new to sewing, but certainly B, if you don't have a sewing machine. So and I'm going to take this moment to do a very brief demo of just like very basic hand sewing. So I've got some thread here, and I'm going to take that to about, I'm going to double this. There's 2 different ways to sew. You can either have like a single line of fabric or a double line of fabric. And I'm going to do a double just because it's a little more durable, though depending on your fabric, that's not necessary. And I'm just grabbing my scissors. Okay, so string, yay, I'm very backlit, aren't I? Okay, there we go. Cool, so I will cut my string here. And then I'm just gonna take the end and put that through the needle. If you have a threader, it's a great tool. One of the things that I left at my house, I moved to my friend's place downtown to go to the protest, and so I don't have all my materials. But generally, if you have a little bit of patience and okay eyesight, I find I can just put it through myself. But there's some videos on YouTube too if you're like, how does a threader work? And so then once I have my needle through my thread here, I will tie a knot at the end of the string. I'm just gonna put that around my finger and then loop both of these through. And then do that one more time. Just to make sure that I've got a good knot there. So I've got a knot at the end of my string and my needle on the other end. Returning back to my fabric here. I'm just going to take my needle and put it, I'm trying to figure out if there's a way to get you guys to see this better. Okay, there we go. So my needle's here. I'm making sure that the edge of my fabric is kissing, and then I will pull it through. Exciting things. Okay. Then again, with sewing, there's many different options and ways you can do particular stitches. What I tend to do is sort of like a hem stitch, which means that I would go from this point here really close to that stitch that I just came through, and then come out a little farther from the bottom, just so that on top, it doesn't really matter for this particular line because we're going to turn it inside out or right side too anyway, but just to show you what that looks like, I will go in right there. You can see it's pretty close. Push it through, And then on the other side, I'm gonna take a little bit of a further step. So more like that, a full kind of, I don't know what that is, maybe like 1/4 of an inch or so, and pull that nicely through. And so you can see, oh, it got a little caught in the tail. I'm gonna wanna cut that tail just so it doesn't get in the way again. But so that's one side, and then the other side here, you just have those little dots. So that's like a very basic stitch. Again, there's more videos of that and what exactly happens there, but truly anyone can hand sew. I believe in all of you. Okay. Oh, I should also show you, I guess, yeah, quickly how to tie off too, which is just that you will go back through your fabric once. So I just got a little bit of fabric under my needle, push my needle through, and then again, there's a couple different ways to tie knots. My go-to is just going through that loop I just made right there. So it's like through the fabric, but not all the way, or not all the way pulled top. And I'm gonna go through once and then twice. So I just literally ducked it through that hole and then pull tight. And that means it will stay on there. Anyway, yeah, so that's basic, very basic hand sewing. Again, not an expert, but it's been working for me, and consult YouTube for more details. Okay, great. So now on to more specifics on our patterns here. Okay. So yeah, once we sewed all the way across the top, it would look something like, let me turn this the right way. This. All right, so it's very faint, but there is a seam right here at the top, right? I said this with a sewing machine, that's why it looks so pretty. But the second step here is gonna be to sew in your elastics. And so this is tricky because depending on what you use as ties, you might wanna do something different. If you're doing elastics, it's really nice to do them attached at this point, but if you're using, whatever this is called, t-shirt yarn, I think it might be easier to attach them at the end. So I'll show you that in a moment, but for elastics, let's go with that for now. Basically, I would just position it right up in the corner by the seam and then all the way in the corner down here and sew that back and forth. You wanna get it a couple lines back and forth to make sure it's really solid, and then do that on the other side. So you would take your second piece and line it up on the edge. So as though you're putting the entire elastic inside and just pulling this to the corner here. So you actually can't see the elastic on the inside. That's going to be important because we're about to turn this mask right side too. So the elastics will then turn to the outside. So you would do that on both sides. And then you would turn it right side too, as I just said. This one only has elastics on one side because it's a demo piece, but you can see now we've got that lovely elastic on the side. And then the next step here is going to be to create your pleats. So that's gonna end up looking like this. Again, get creative with what you are using as your pleat material. I've got, or pleaters, I've got a couple of needles and a couple of clothespins. So the easiest way to do pleats is that you're gonna fold your whole piece right in the center. And again, if you have an iron, highly recommend going ahead and making a really crisp line on that. Right, so we fold it like so. And ideally just press that down a little bit in lieu of ironing. But now I can see I've got a little bit of a line right there. And I'm gonna take that, again, your fingers are great tools. If you just take one finger onto the side and say, okay, well that's about somewhere between about a ½ an inch, I would fold that down like so, and then I would pin it. Sadly, I don't have enough pins to properly show you the pinned one and pin this for you right now, but imagine this stayed pinned. And then what you would do is just go halfway between the top section and halfway between the bottom section, and that will get you something that looks like this. And what's great about sewing by hand is it's really easy to just actually keep this pleated and then sew right along the edge of sort of the things that are fastening, and that will hold the fabric together. So that's like the main tutorial for something that looks like this in terms of the elastics. Here's what it would look like as a finalized piece. This was one of my first masks, so its craftsmanship is imperfect, but it does the job. You can see it's got pleats there and goes on my face like so. But yeah, the other thing that I mentioned before is you might want to adjust depending on what you're using as your ties. So another really great way to do this is actually if you're using t-shirt yarn, what I did to make this here is I aligned the t-shirt yarn on the edge, and then I just folded over the side of my mask and sewed around the t-shirt yarn, which is great and super easy to do, and actually frankly a little bit easier than the elastics. So what that would look like on this side is I would just lie my fabric down on the edge of the mask like that, and then I would just fold it over and make a little pocket, and then we would have it contained. So, and you can do that either, again, you can get creative with how this looks. Like the way I was envisioning this was one long strip on this side, and then I would have to cut another piece and do it on that side and tie them around. But you could also have a continuous piece here. I would recommend doing 2 separate strips for each side and tying them for this type of mask. Cool. So those are pleated masks, great for beginners, do the job, and pretty forgiving, especially if you're hand sewing. Keep a seam ripper on hand too, and you can basically go back and edit your work. Oh, sorry, we're going over it. I feel bad. Also, my computer literally has 1% battery. I just have to grab my charger. I'll be right back. Sorry, guys. Walk you through, for those who can stay, the steps for the second type of mask, which is this fitted craft passion mask. So we've included the links for the patterns in the Google document. They're really easy. They're great if you can print them out. There's one that's a larger size and one that's a smaller size. And if you can't print them out, you can also load them up on your computer and trace them that way.
We also have kid sizes. So if you want to make kid masks.
Yeah, so it's like actually a whole bunch of different options. Yeah, so the first thing you're going to do is, if you can see here, this is where I have done some tracing. And basically just trace out those patterns on your fabric. The key with tracing is that you want to make sure you do 2 different versions of the mask, one with it face up and one with it facing back, because if you do them both facing the same way, it will ruin everything. So it's fine, you can use it for a different mask, but you just can't use 2 different ones together. Okay, then what you're gonna do is once you trace, you'll cut out those individual pieces, which looks something like this. And you should have 4 pieces total, 2 for a front check section and 2 for a back section. Then you want to sew those pieces together. So you'll sew the front pieces and the back pieces together. And that's going to be along this curved line right here. Super fast and easy to do with the sewing machine. The key is you want to make sure that the good faces are touching one another and the bad faces are out. So you can see that's here for both of these things. Once you do that, you're going to want to turn these right side to. So now the nice side is facing you, and you'll sew another seam that's directly next to this thing that you just sewed, with just a little bit of reinforcement for the front. Danny is on stack. You have a question?
Hey, Marielle, which side of the fabric is like the bad side and the good side?
Great question. So basically, it's like if you're working with fabric or a pillowcase or something, the outside of the pillowcase is the good side and the bad side is the inside of the pillowcase. So usually there's just a little bit more finish. I really like to, when I'm measuring, like write something on the center like I think this was a like women's cut and then it's an outside piece. So I don't get confused, and also so that I don't have to try to figure out which is good and which is bad.
With patterned fabric, like it's just like the pattern's just on one side usually, or like kind of like lighter on the other side. So the side that like looks nicer is the good side. The
Yeah.
side that looks not as nice is the side.
Exactly. Thank you for that. Great question. Cool. So yeah, once you sew along this front edge, I can show you, yeah, this one here. It's hard because I used a light thread, which is nice for the mask, but hard for a demo. But you can see there's a seam that runs down the front of that. So now I've got two pieces attached to each other. We went from 4 to 2. Great success. So the next thing you're going to do is put the larger piece to the side for a moment, and you're going to grab just the smaller piece. And what you want to do is take a ruler and measure in about 3/4 of an inch and draw a line. If you wanted, you could also take that line all the way up if that made your life easier, but I was lazy and just put a tick mark. And then you're going to fold in the edge of this smaller piece. Again, you want it with the bad side of the fabric facing up, unfinished side, I guess I should say. And then you're going to fold so you have a little bit of this finished side showing. Ideally, if we want proper craftsmanship, we also want to fold in this jagged edge slightly before we sew. So just a little bit. And then we're actually going to fold over on that line we just drew. So it looks something like this before you sew it. So when that actually comes together, it looks like this. So each of those two sides has been brought in just a little bit. At this point, we're going to return to our larger piece of fabric. Hold on to that smaller piece of fabric too. We're going to put the good sides of the fabric facing each other. So it looks like it's inside out. And it's going to look something like this if you're looking at it from the inside. And now we want to attach these two pieces. So you'll simply sew along the top and here as well, those curved lines, and then sew all the way across this bottom edge too. You're going to leave these sides open because that's going to create your pocket where the filter will go. So when that happens, it ends up looking something like this. Another small note is that they say you're supposed to cut the little seams of these inner parts for flexibility, which frankly, I don't know that it makes that much of a difference, but if you feel so inclined, that's in the directions as well. So now it looks like this, which is great. And we're gonna turn this from inside out and turn it right side too.
If you're adding, so you can add like a nose thing in it. I haven't for most of mine. I do wear glasses, so it is nice to have that nose thing so your glasses don't fog up. But if like you don't want to, you don't have to. Right. They're in the instructions too, but
exactly, it's
you would do that here at this step.
It's a bit of a creative act, you know. And after you make one, I think you get a hang of what feels possible. So I've just turned this all the way right side too. And now we're on to the final step, which is basically just to sew these little edge flaps down. And what we're doing here is creating a little bit of a like passageway where we're going to be able to pull our strings through. So again,
do you not do a top seam first or like top stitch first?
I usually just go here. Tell me if you do something else, Gabrielle. I don't know.
I usually, I don't have like a proper, I usually like sew along here and along here first once it's turned inside out.
Stability.
It's for stability, but it also like those little, I can't point, not in person, along the edges, those pieces that are like a little bit too long, like if you fold those down and like sew along that, it just like makes it cleaner. And I found it, yeah, like where that, go to the edge with your hand. Yeah, so like that piece. So like if it's folded over, then you sew along that, but like also sew a top stitch there. That's usually what I do.
Lovely. Okay, great. So you can also add that step for extra well-made masks. Thank you, Gabrielle. I love it. Or we're just going to show you the rough and tumble version right now, which is folding the edge of this in slightly and then folding it all the way over to meet that other piece of fabric. And so that's going to create a little like cavity where you'll be able to put de-string momentarily. So ultimately it looks like this. Apologies that clearly I used many different fabrics to make this, but that's what we're working with. We've got a lovely pocket right here and here, and then space for your string to go through here. Sorry, you can't see that. And yeah, I think that the best thing for these types of masks, you can actually just put elastic through this as well if you have that on hand. Also, if you wanted to do hair ties, I recommend putting those in before you stitch it, but you can also put a hair tie in here and that's an option. Or my ball of string just went somewhere else, but if you were using this type of fabric, it helps to just like put a needle through a knot at the end of this, and then just tug that through. So it makes it a little easier to pull it through this crevice. And then ultimately, it looks something like this. And we'll fan your face and protect you from germs. That was a lot of information. I tried to go quickly. I hope you absorbed some of it. But also, I'm very down to be around for you all and chat about sewing strategies. I think my number's both in the slideshow here, and also you can find me on Slack. But really, I think the key is it's something that you'll learn by doing, and there's a ton of resources in a document we're going to share with you all as well. Okay, thank you. Any questions? No? All right. Well, I will turn it back to you, Gabrielle.
Yeah, thank you so much. That was great. Do we want to get the slideshow back up, Danny? Is that possible? Once you do it, it makes more sense. Like reading the instructions was confusing to me, and then like I just did it and I like understood what it meant. Is Danny still here?
I think Danny actually has to hop off, but I'm going to pull up the slides for y'all. So which slide, where were we at, I guess?
I got
No,
the
I
slides
got it,
up.
don't worry.
No.
If you insist, I will do as you say.
Please excuse my 5,000 math tabs. It's embarrassing. Okay. Yeah, so the final thing is just to sign up. So in order to participate, the best way to do that is to fill out the sign up form. Jordan will be following up with everyone tomorrow, sending you an email with the recording for this so you can look back at it if you want, or if someone had to hop off, as well as the sign up form and contact information, as well as a little guide that we all put together with both the templates for different types of masks, how to make the t-shirt yarn, some basic sewing tips, some sewing machine tips, as well as YouTube tutorials for this. So like there's a lot of good YouTube tutorials, so we picked some of the ones we liked the best that you can watch that are also super helpful. And the other thing is to join us on June 18th at 7 p.m. where we will all be making masks together. So if you have tried to make a mask and still had some questions about how to do that, that's a great time to join and ask those questions IRL-ish, not really IRL. Yeah, and just fill out the form as soon as you can so that we can coordinate deliveries of materials, because if you need anything, we'll ask you about that in the form. I know I'm like running lowish on fabric, so like, you know, if anyone else is running low on materials, we can make sure to get you stuff soon. And again, Jordan got some great materials, so that's exciting. Yeah, and if you have any other questions, contact Jordan, Marielle, or me. That's it. Thank you all for joining.
Thank you. And thank you, Gabrielle and Rachel and
Thank you.
Marielle and Oscar for this amazing presentation. I feel not only more ready to actually get started sewing because I have zero sewing experience, but also am very appreciative of the context that you gave nationally and locally. All of that is so important as we enter this work. And I'm really excited to hopefully get to 100.
Yeah. Also, if you guys have anyone who wants to hang out with you and sew, or virtually hang out with you and sew, or come to our sewing party, like we can definitely slow things down a little bit. Because yeah, I think going step by step all together is probably an easier way to do this than tossing it all at you at once. So bring more people, more sewers would make all of our lives easier and better.
And it's fun to hang out. All right. Bye, everyone. You all want to say like masks or whatever. Mutual aid.
Mutual aid.
Mutual
Mutual
aid.
aid.
Mutual aid.
Mutual aid.
All right,
I'm gonna
bye,
stop recording
guys.
now.
Bye.
Peace.